Hello, my name is Hailee Santos. I'm a Sports Med 3 student. This is my 6th project, and it is medical journal research on hardware, the removals, the differences, and both of them. I'll first start off by explaining what hardware is. Hardware is a biological or non-biological material that is placed inside or on the surface of the body. Implants refer to the objects that are used to hold bones together, strengthen tendons and ligaments, or attach them to bone and replace bone to help to ensure optimal patient outcome. One form of hardware or surgery is ORIF procedure. Open reduction internal fixation are procedures that require hardware to be inserted to restore normal structure alignment to the bones. These surgical implants / hardware help to ensure osteosynthesis, which is where the bone hardens around the hardware. There are a lot of risks that come with open reduction surgery, and some of those being bacterial infection from the hardware incision, bleeding, blood clot, nerve or blood vessel damage, tendon or ligament damage, incomplete or abnormal bone healing, metal hardware moving out of place, reduced or loss of mobility, muscle spasms or damage, arthritis, tendinitis, audible popping or snapping, chronic pain due to hardware, and compartment syndrome. All those symptoms still occur even if you do have hardware removal, of course, except for the damaged hardware itself. When you should remove hardware, it is based off of activity limitations or pain or an infection caused from the implant. It may be done because some people have allergies from the implant. 68% of patients report symptom relief post-hardware removal, so hardware removal also helps with the pain levels. Another hardware surgery is external fixations. External fixations are when the fixators are on the outside of the body. These fixators commonly being halos, pins, and rubber bands. Halos wrapping all the way around the injured area, and the pins going into the skin all the way through the bone and putting them back into their proper alignment. For the risks that go along with external fixations, a majority of complications are infections at the pin site and osteomyelitis, DVT, pulmonary embolism, aseptic loosening, fracture or non-union of the existing fracture, and loss of reduction. How to determine the difference for these surgeries and when you would need what surgery is external fixation is to keep the bone stabilized and in alignment. The external device may be adjusted to externally to ensure the bones stay in position. ORIF involves the surgical implantation for the purpose of repairing bones. So external fixation would be more to keep that proper alignment, and ORIF would be more to repair the bones themselves. Overall, there are different reasonings behind each hardware and their choices. For the removal of the ORIF hardware, it really depends on patient. A lot of patients do feel relief when it is removed. A lot of patients see a lot more mobility come back from the removal of their hardware, and you can really never know until you do get it removed or your doctor tells you that it is necessary to continue functioning properly. Overall, thank you for listening to my presentation. I know it's long, but if you have any questions, feel free to ask.